Let's talk about something that might make you squirm, but it's important. Genital warts. I know it's not a comfortable topic, but knowledge is power, especially when it comes to your health. Genital warts are a type of sexually transmitted infection, or STI. They're caused by certain strains of the human papillomavirus, or HPV. Now don't panic. HPV is incredibly common. In fact, most sexually active people will get it at some point in their lives. But not everyone who has HPV will develop genital warts. These warts can appear on your genitals, in your anal area, or in your mouth. They might look like small, flesh-colored bumps or resemble cauliflower. So let's get started on this journey of understanding genital warts. Alright, let's get down to the nitty-gritty. What exactly are genital warts? They're small, fleshy growths that appear on or around the genital area. They can be flat or raised, single or in clusters. Some people describe them as looking like tiny cauliflowers. These warts are caused by certain types of HPV, or human papillomavirus. There are over 100 types of HPV, but only a few cause genital warts. The main culprits are HPV types 6 and 11. These types are considered low risk because they don't cause cancer, but they can still cause a lot of discomfort and worry. Genital warts can appear anywhere in the genital or anal area. In women, they might show up on the vulva, in the vagina, on the cervix, or around the anus. In men, they can appear on the penis, scrotum, or around the anus. And yes, they can even appear in the mouth or throat if you've had oral sex with someone who has the infection. That's why it's so important to practice safe sex and get regular checkups. Using condoms and dental dams can reduce the risk of transmission. Regular screenings and being aware of any changes in your body can help catch issues early. Let's talk more about HPV, the virus behind genital warts. HPV stands for human papillomavirus. It's not just one virus, but a group of more than 100 related viruses. Some of these can cause warts on your hands or feet, others can cause genital warts, and some can even lead to certain types of cancer. Most HPV infections don't cause any problems at all. Your body's immune system usually clears the virus on its own within 2 years. But sometimes the virus sticks around and causes issues. There are two main categories of HPV: low risk and high risk. The types that cause genital warts are usually low risk. High-risk types can cause changes in your cells that might lead to cancer over time. That's why prevention and regular checkups are so important. Now let's play a game of Spot the Difference. It's important to know how to tell genital warts apart from other conditions. Why? Because proper identification leads to proper treatment. Regular warts, like those you might get on your hands, are also caused by HPV. But they're different strains. Regular warts are usually rough and grainy. Genital warts tend to be softer and smoother, and of course they appear in different places on your body. Pimples can show up anywhere, including your genital area, but they're not the same as genital warts. Pimples are usually red and inflamed. Genital warts, on the other hand, are flesh-colored or slightly darker. Some sexually transmitted infections can cause bumps that look similar to genital warts. That's why it's so important to get checked by a healthcare provider if you're unsure. Section 5. How genital warts spread. Let's talk about how genital warts spread. Understanding this is key to prevention. Genital warts spread through skin-to-skin contact. Usually this happens during sexual activity. That includes vaginal, anal, and oral sex. Even if there are no visible warts, the virus can still spread. That's because the virus lives in the skin cells. Condoms can help reduce the risk of transmission, but they're not 100% effective. The virus can live on the skin around the genitals, areas that condoms don't cover. You can even infect yourself by touching a wart and then touching another part of your body. That's why it's so important to wash your hands after touching any warts. Section 6. Recognizing symptoms. Do you know how to spot genital warts? Recognizing the symptoms early can make a significant difference in managing the condition. It's important information that could help you catch a problem early and seek appropriate treatment. The most obvious symptom is, well, warts. These warts are typically small and flesh-colored. These are small, flesh-colored bumps that appear in the genital area. They can vary in size and shape. They might be flat or raised, depending on the individual case. Sometimes they grow in clusters looking a bit like cauliflower, which can be quite distinctive. But sometimes genital warts are so small you can't see them with the naked eye. Or they might be hidden inside the vagina or anus, making them even harder to detect. Most people with genital warts don't have any pain or discomfort, which can make them easy to overlook. But sometimes, the warts can cause itching or burning, which can be quite uncomfortable. If they're in a spot that gets irritated during sex, they might bleed, adding to the discomfort. And in rare cases, large warts can make it difficult to pee or poop, which can significantly impact daily life. Not all bumps in your genital area are warts. Other conditions can cause similar symptoms. That's why it's so important to get checked by a healthcare provider if you notice any changes in your genital area. Early detection and treatment can make a big difference in managing your health. Section 7. Diagnosis and testing. Now let's talk about how doctors diagnose genital warts. This process is crucial for ensuring you get the right treatment and care. It's not as scary as you might think. In fact, many patients find the process to be quite reassuring. In fact, most of the time, it's pretty straightforward. The steps are designed to be as simple and stress-free as possible. The first step in diagnosis is usually a visual examination. This is often the quickest and easiest way to identify genital warts. Your doctor will look at the affected area to see if there are any visible warts. They are trained to spot even the smallest signs. They might use a magnifying glass to get a better look. This helps them see details that might not be visible to the naked eye. If the warts are small or hard to see, they might apply a vinegar solution to the area. This solution helps in highlighting the warts. This can make the warts turn white, making them easier to spot. It's a simple yet effective method. Sometimes a visual exam isn't enough. In such cases, further testing is necessary to ensure an accurate diagnosis. In that case, your doctor might take a small sample of tissue. This step is crucial for a more detailed analysis. This is called a biopsy. It's a common procedure that provides more information about the warts. The sample is then examined under a microscope to confirm if it's a wart and what type of HPV is causing it. This helps in tailoring the treatment. That's why regular checkups and open communication with your healthcare provider are so important. Staying informed and proactive can make a big difference in managing your health. Section 8. Treatment options for genital warts. Alright, let's say you've been diagnosed with genital warts. What's next? There are several treatment options available. First, it's important to know that genital warts often go away on their own. Your immune system can fight off the virus, but this can take months or even years. And during that time, you can still spread the virus to others. That's why many people choose to get treatment. One common treatment is topical medications. These are creams or solutions that you apply directly to the warts. Some of these, like imiquimod or podophylox, you can apply at home. Others, like podophyllin, need to be applied by a healthcare provider. If topical treatments don't work, there are other options like cryotherapy or electrocautery. For larger warts, surgery might be necessary. Remember, no treatment is 100% effective. Section 9. Prevention strategies. Now let's talk about everyone's favorite topic, prevention. When it comes to genital warts, there are several steps you can take to protect yourself. First and foremost, get vaccinated. The HPV vaccine protects against the types of HPV that cause most genital warts. It's recommended for both boys and girls, starting around age 11 or 12. But even if you're older, you might still benefit from the vaccine. Talk to your doctor about whether it's right for you. Next, practice safe sex. Use condoms or dental dams every time you have sex. Remember, condoms aren't 100% effective against HPV. Regular checkups are crucial, and both men and women should get tested for STIs regularly if they're sexually active. A strong immune system can help your body fight off HPV infections. Section 10. Living with genital warts. Let's face it, getting diagnosed with genital warts can be tough. It's normal to feel embarrassed, angry, or scared. But remember, you're not alone. Millions of people live with HPV and genital warts. First, follow your treatment plan. Take your medications as prescribed, keep your follow-up appointments, and be patient. Treatment takes time, and warts can come back. Now, let's talk about sex. Yes, you can still have a healthy sex life with genital warts, but you need to be honest with your partners. Tell them about your diagnosis before you have sex. Use protection every time. Section 11. Conclusion: empowering yourself with knowledge. We've covered a lot of ground, haven't we? From understanding what genital warts are to how they're treated and prevented. But let's take a moment to reflect on why all this information matters. It's not just about avoiding a pesky infection. It's about taking control of your sexual health. Knowledge is power. By understanding genital warts and HPV, you're better equipped to protect yourself and your partners. You know the importance of safe sex practices, you understand why regular checkups are crucial, and you're aware of the symptoms to watch out for. But beyond that, this knowledge helps reduce stigma. Genital warts and HPV are incredibly common. By talking openly about them, we help normalize these conditions. Stay informed, stay safe, and stay healthy.